to say something, you say no.
All right, it's one thing to fight coronavirus, or COVID-19 as it's popularly called, as an able-bodied person. And it's another thing to fight the virus when you are a person living with disabilities. Now today we're taking a look at persons with disabilities and how they are coping in this pandemic. Joining us in our studio right now, we have David Aniele. David is the president, Persons with Disabilities Association. We're glad to have you on the program.
Thank you so much. I'm the executive director, Center for Citizens with Disabilities.
I think I looked somewhere else. Anyway, I apologize for that. Anyway, all right. Great to have you. The last time we spoke, that was during, I think, the lockdown, or just before the lockdown was lifted. And you were calling out to the governments to pay attention to persons with disabilities in terms of giving up the palliatives and social distancing and all whatnot. Did anything improve between then and now?
We've not seen any improvement. The highest improvement we have seen so far is that the president mentioned us during his June 12th address. And for the first time in the history of this country, that a president of the Federal Republic of Nigeria is mentioning or including issues of people with disabilities in address. As such, we can say that we've been mentioned. Mentioning is one, and that is action. Action in the sense that we expected that the amendment budget would reflect that mentioning. The amendment budget did not take cognizance of the Discrimination Against Persons with Disabilities Prohibition Act, which provides that the federal government of Nigeria should take appropriate measure to create awareness on the rights, dignity, and success stories of people with disabilities. Also, Section 31 of the Act, which provides the establishment of National Commission for Persons with Disabilities. Anything short from establishing this commission by federal government of Nigeria will not, show or indicate there is commitment to, enhancing the life of people with disabilities. Bulk of the key issues is that the PTF is paying lip service to issues of disability in terms of their interaction with different sectors on ease of lockdown. A lot of document is coming out, different group, churches, private sector, aviation, INEC, and others that have critical services to provide for the public. But for the mere fact that there is no representative of persons with disabilities in PTF on COVID-19, it means that nobody will take measure to review using disability eye lens, to know to what extent these documents protect the right of people with disabilities. We are talking about more than 25 million Nigerians, with 80% living in rural areas with minimal access to social infrastructure. When we, rejoice over the assent to the National Disability Act, we are rejoicing that a new dawn has come, that government program activities, including the private sector, will reflect the provisions of the Act. But we are not getting it. And it seems to us that we are not just left behind, we are not included, we're excluded.
Which is why we're having the conversation this morning, because like you said, apparently it appears that we have to say one thing and then say it again. I mean, literally speaking, I remember you asking the president then during the debate, and he asked the vice president also too. So apparently we'll have to keep drumming it so that they can understand what it is. And I've had a lot of discussions around the COVID-19 pandemic and life after COVID-19, saying that this is the new way of living. And you think that this is the most important, this is the people living with disability, nearly 30 million of them. This provides the best opportunity in saying this is how we want to go, sector by sector. Access to healthcare, how is it affecting people living with disability? Drawing up protocols and guidelines that directly impact us. So in case you don't know, David Aniele is living with a disability, so don't get...
We're looking at him, we wouldn't even notice.
Yeah, so don't get it mixed up. He knows where it pinches. So when he speaks, he speaks from the depth of his heart and his bowel about the pains people who are living with disability are going through. So don't be deceived by the smile and everything. A lot is happening. So you're talking about INEC with the elections going on in Edo State. They already know exactly what to do. Whether they will carry it out is another matter entirely, but at least it's written in the guidelines for INEC with Edo and Ondo State and going for the other elections. But What are your concerns? Let's stick with transportation. I know this is a big sticking point because I've seen a number of surveys where people with disability, even on my radio show, say, look, we are not being taken into consideration with transportation.
That's exactly the issue. A classical example is Lagos State.
Good.
We are, you know, prior to the emergence of COVID-19, there was ban on keke, Okada riding in different places. But the state forgot to recognize that the easiest means of movement for an average physically challenged person is that keke and Okada. The reason is simple. Keke can get closer to his residence. It's easy for him to maneuver and enter because it's very low. So if a physically challenged who is on clutches wants to enter, he can easily enter it. So there is no kind of provisions to say, except if a person with disabilities is using A, B, C, D, that should be exempted. So immediately that prohibition was made in Lagos, people with disabilities, physically challenged people were, you know, afraid about how their future would look like. In fact, physically challenged who are working in my office, in fact, we wanted to ask them to start working at home to understand how the new directive from the state will affect them. Now, there is COVID-19. And COVID-19, there is a law in Lagos State, discrimination, Lagos State Special Purpose Law, which provides that access should be given to people with disabilities in public transport. So when you get to the bus stations, you see queues, you see people scrambling for seats. People with disabilities are not considered. So access to transport is a huge challenge for people with disabilities.
Maybe it's the enforcement, because I'm aware that in Lagos State, for the BRT terminal, people with disabilities, old people, pregnant women should be given preference before they get into the buses. I don't know if that is enforced, because that's the law, that's the rule given by the Lagos State government. So are you saying that people with disabilities are not considered in such cases, at least for the BRTs?
For the BRTs, in some bus stops do recognize people with disabilities. Many of the bus stops, especially along Ikorodu Road, they give priorities to people with disabilities. But how many people with disabilities live along that corridor? Between Ikorodu,
and how would you even get there anyway?
How did they even get to that bus stop for them to get access? These are the issues we are addressing. So until Lagos State government, in particular, take appropriate measure in demonstrating that there is a law in Lagos State that supports equal opportunity for people with disabilities, by ensuring that Lagos State Office for Disability Affairs, the Lasoda Board, is constituted. For the past, it's getting to 1 year now, the Lagos State Office for Disability Affairs has not been constituted. And that is a problem. So that office that's supposed to help government to coordinate affairs, especially in this period of COVID-19, lockdown, it's not functioning properly. So as it's not functioning properly, the governor is not getting appropriate advice on approaches on what to do in order to ensure there is no gap in this area. As I speak to you, the governor is here to recognize that people with disability live in this state.
And interestingly, Lagos has the highest number
of
people who are living with disability, if I'm not mistaken, something close to 5-6 million, if not even more, people living with disability in this state. And another opportunity would have been with the, thankfully, they decided to not reopen the airport, but I was already thinking, last visit I made to the airport, I'm not too sure, I don't think we have in place things or infrastructure, or like I like to say, gizmos that will help people who are living with disability get around the airport that easily, like you will see in other climes where people with disability are given special preference in the way movement happens within and around the airport. But they were going to open the airport, and I was asking earlier whether the people living with disability were spoken with to get their input in the guidelines and the protocol. Did that happen?
I'm telling you that the PTF does not recognize that people with disabilities are part of Nigerians and that they are disproportionately affected by reason of this COVID-19. Only the MM2, I mean, the second airport in Lagos, that is the only airport that's disability friendly in Nigeria. Other airports, other local airports in Nigeria are not disability friendly. So you see a person on a wheelchair wants to board an aircraft, local airport in Abuja or in Owerri or in Port Harcourt. The person had to be lifted up, carried like a cargo inside the aircraft, depending on your size. There are some individuals, by reason of their size, you will struggle much more.
This is before social distancing.
Before the advent of coronavirus. So now, the Nigeria Civil Aviation Authority are now working out modalities for the opening of airport. So the question is, to what extent is this modalities or this guideline addresses disability issue? And we are saying that the airport should not be open until it is accessible to people with disabilities. It's disheartening that the aviation minister, engages the operators in our airport without asking the question, to what extent is this going to affect people's abilities? And I'm saying that the government of Nigeria will put not just people with disabilities at risk, but also their family members. If the airport is open without ensuring that adequate infrastructure is provided in all the airports to ensure that people with disabilities have easy access. And this is legal. It is in line with the law. It's also in line with international practices that every airport should be made accessible to all. You're on wheelchair, you don't even know where to follow. You don't even know where there is exit for you or entrance for you. So when you get to the tarmac, you start negotiating how are you going to enter. People will, to struggle to know who is going to lift you, who is not going to lift you. If people with disabilities are going to be lifted into the airport or into the aircraft, it then means that we are not serious about social distance. We are not serious about flattening the curve, because we are citizens. The country belongs to all of us, and all our infrastructures must be made accessible to all.
Now, if you're called to a roundtable discussion now with the Minister of Aviation and some other government personnel, and they ask you, what strategies do you think should be adopted so that the needs of people with disabilities will be met? What strategies will you say these things are, not only for aviation, basically, for every other sector?
For our airport in particular, there are equipments that support physically challenged people to have unhindered access to aircraft. I was in Cairo last year for a meeting, and because we were about 2 persons with disability from Nigeria attending the event, at the airport, we didn't follow, as we are coming out from the aircraft, there is a special van they provided just beside the other door. The van has a lift that when they press it, it will just come at the same level with the exit door. If a person on clutches or on wheelchair, you just roll in, and they'll press the button, the lift will go down, and the vehicle will carry you at the arrival hall. You just get down, you enter.
This is Egypt, Africa.
I say Egypt, not in Europe, Egypt. In other countries, what they do is that the entrance is made high at the same level with the exit door of the aircraft. So just as you do at MM2 here in Lagos, you don't need to struggle. You just wheel in, go out, go your way. Nobody knows when you enter, nobody knows when you're going out. But for the fact that infrastructures in Nigeria are not designed for all, it is designed for the use of privileged individuals that have access to government. As such, they don't consider other people, in this provision. But we are glad, that we have a law that says this is how it should go. And if federal government of Nigeria failed to do that, we have no other choice than to mobilize our lawyers. We have already, briefed our lawyers and to ask them to, be on the look. Because we thought that they are going to open that airport today, and our intention is to use the legal instrument to stop them, and to compel federal government of Nigeria to ensure that our airport are accessible. not just for physically challenged people, pregnant women, elderly, you know.
Absolutely. This is a perfect case in point.
It's not just about a physically challenged person.
David, a case in point where we use one sector where, like you were asking, the question, oftentimes when the policy is being made or formulated, or guidelines or protocols like with the coronavirus pandemic, the question is, how does this affect the 30 million people? In fact, I think it's better people will even understand 1 in every 8, in fact 6 or 7 Nigerians is living with a disability. That's how serious this matter is.
That's correct.
How is it that you don't ask them that question, how it affects them, whether it's with the reopening of schools, with the reopening of the transportation sector, or with the hospitals, in saying this is how we're going to formulate the guidelines? Why does it appear this deafness?
It is attitude, our inherent response to people with disabilities. There's this, cultural mindset or religious mindset that people with disabilities does not matter. The life of a person with disability does not matter. That is the act of this of our people. You know what it took us to get the law signed. You know how pushful we made. For 18 good years we were pushing. To the extent that you recall when I engaged the president, and the president said before Nigerians that he's not aware that the law has been passed at the National Assembly, transmitted to his office. He was not aware. Whereas there were individuals that dispatched the document. We saw the copies of the dispatch. So, you see, and that group will do their own work, and that group will not understand, or the other department will not know what is going on, because it is not a priority to government. The life of a person with disability is not a priority to any government. Look at what the struggle we are in different states. People with disability, we are struggling to draw the attention of government that they should give them palliatives. It took 6 good weeks for the Minister of Humanitarian Affairs, Disaster Management and Social Development to send palliative to people with disabilities in Abuja 6 weeks after she started distributing. Ordinarily, in other climes, what you see, they start from the most vulnerable to the least vulnerable. But here in Nigeria, it's about class. Everything is about class. Everything is about class. So when people who are not there at the policy table, if you don't have access to a person, in government, you may not be able to get your voice heard. And you saw that during this pandemic, we are told to sit at home. So who are you going to send documents to? You don't have the email address of the responsible officer so that you can be able to communicate. In fact, I was engaging one of the PAMSEC at the office of the Secretary to the Government of the Federation. I was drawing his attention. I was using WhatsApp to communicate. At a stage, he said, okay, he's going to, liaise with them so that they can, factor these issues. Till today, he didn't get back to me again. So that is the only medium we have is this your platform, where we use to draw attention of Nigerians, asking Nigerians that have access to these people to put words for us by saying, have you considered people with disabilities in this document? To what extent is this document going to, support or affect them?
I know how painful it feels when what you deserve is not given to you for whatever reasons it may be. So much has been said about this for years now, because I know that since I came to Silverbird, we've been talking about this. That's about 3 years ago, and it looks like nothing has changed. Now, looking at it, we are in Lagos, and it looks like we have already established, majority of people with disability reside in Lagos. But other states, I know we're looking at the federal and state governments anyway, but for states now, how many states are even considering, giving what deserves to people living with disabilities, giving it to them? Airports, transportation, and any public facility, hotels and all of that. Do you think other states are, living up to that standard, what is required for persons with disabilities?
Yeah, I can mention that in some states are taking measures by creating laws, policies.
But having laws is not just enough. Enforcing it.
Yeah, what we say law is to say this is a document, a guide to respond. I know that in Anambra State, during this COVID-19, the governor not just passed disability law, he also appointed a special advisor on disability matters. He even went as far as hiring special assistance so that they can be able to help him coordinate disability-related issues. So in such kind of environment, you will see that effort is being made to ensure that policy framework reflect people with disabilities. States like Plateau, Kano, Bauchi, Jigawa, even Kwara, Kogi, they've all passed the law. But it's for them to begin to build their capacity to respond to the provisions of this law, because they don't have capacity. Recall I said earlier, we are coming from a background where we stigmatize people with disabilities, where we see a person with disability as a carrier of one disease or virus or the other, or sins of the fathers, or misbehavior that led to it. So people don't want to mingle with such individuals so they will not contaminate disability. And this is all lies. There's nothing like that. Right. So we are saying that state government, we even should take appropriate measure to pass a law, should equally ensure that the cabinet they are formulating has someone with disability that can support the government and advise on approaches. A classical example is Abia State. In Abia State, the former House of Assembly passed a disability law just for the governor to assent to it. He denied assent. As I speak to you, nothing is going on in terms of government response in Abia State and people with disabilities. So for them to get a palliative, they had to do protest during the COVID for them to see that there is something gets to their own members. And out of all their struggle, they were only able to get about 6 bags of rice in a state that has over 300,000 persons with disabilities. But the state was busy sharing the palliatives to churches, to associations, to community groups. And I called the commissioner for information. I said, how do you think, you that is government, you don't prioritize people with disabilities, how do you think that these communities, this religious group will prioritize them? When your public statement did not say that people with disabilities should be given priorities in all these things you are sharing. So on our part, we are saying that government at all levels should take appropriate measure to identify technocrats or technicians that can support them in ensuring their program and activities reflect the desire of people with disabilities.
Why I like having conversation with David Ahiele is because he's practical. It talks about exactly how it affects, and that's the way people can understand what they're doing wrong and what needs to be done urgently. In the case of the airport, you must put the infrastructure in place to help people who are living with disability for it to happen. So no one will say, we didn't know what to do. This is what the problem is. This is what the solution is. There is no middle ground for this one. In the recent survey, David, conducted by the Bureau of Statistics, 3 of the biggest concerns of people living in this country had to do with access to health care, food, and the other one was access to health care, food, and education for the children. And it got me thinking. I know a number of state governments are doing what they call radio classic, but I said, how does someone who is living with a disability, for example, access this education during the pandemic, before the reopening of the schools, which is another matter entirely? So from your interactions with people who are living with disability, how have they been able to go through this one? Because even people who are not living with disability still find it difficult going through this virtual or radio schooling during the pandemic.
It's difficult. Government designed this program just to feel good and to tell the people, oh, we care, without necessarily thinking about who is going to benefit and how. These are key issues. We were monitoring this radio class on radio program of different states. Here in Lagos State, they are doing the same thing. And while they are doing it, they didn't include people with disabilities. In Abia State, they did the same thing. They didn't include people with disabilities. In Akwa Ibom, the same thing happened. Guess what? When we tracked Abia State School on Radio program, we decided to engage them. When we engaged them, the Joint Association of Persons with Disabilities in the state approached the Commissioner for Education, Abia State, requested that the school on radio should be moved to school on TV, so that there will be a sign language interpreter that will interpret for the deaf, so they will be able to see or hear or understand the lecture that was going on.
Excellent.
Do you know the information we got? We are told that Abia State government do not have a budget to include a sign language interpreter.
Wow.
On that. What does it cost? On that basis, We told the government that we are going to sponsor sign language interpreters to support the program. As I speak to you, our organization, Center for Citizens with Disabilities, is sponsoring 3 sign language interpreters in Abia State for deaf people to participate on the program. And we told the government to move the program to TV, so there will be a sign language interpreter. That is how difficult to live in Nigeria with disability. The programs, activities of government are designed without any consideration of the weak. So a policymaker will just wake up in the morning and say, oh, Your Excellency, this is what we want to do A, B, C, D. Oh, you say, oh, very good, I approve. How? Who are the beneficiaries? Where are they? What are the challenges? How do we provide? Even when you are bringing suggestions that will support them to enhance it, they struggle to accept it. Because in most government activities and programs, it's all about procurement. It's all about what gets to their pocket. So it's not necessarily because they want to do it because you want to benefit. But sometimes it's because there is something that is entering somebody's pocket at that particular time. So for you to add or increase or reduce, budget has been already been manipulated. Inclusion becomes difficult. Enhancing the program becomes very unrealistic because abuse has taken place in budgeting.
Okay, so now let's round off by re-echoing what you want for persons with disabilities. Let's re-echo it and tell the government again this last time before we round off this segment.
We are saying that if government want to open the airport, they should do what we call audit of its airport access to people with disabilities. That is to say, audit the whole process, checking in boarding and disembarking. To what extent are people with disabilities going to have easy access with minimal interaction with anybody in trying to access the airport? That is one. 2, we are saying that school on radio program should equally be moved to school on TV program where there will be a sign language interpretation. We are also asking that NCDC should tell us number of people with disability that have been confirmed positive to coronavirus. Because it is when we know number of people with disability that have been confirmed positive to coronavirus, we'll be able to know the extent of access and provisions that they are receiving in order to ensure that there is no exposure. Because you may see that in some certain cases, we have seen cases where medical practitioners query people with disabilities for trying to access health care. You see a pregnant woman with disability or wheelchair, you'll be hearing, oh, who did this thing to you? Who did this thing to you? That person must be a wicked person. Does it mean that a person, a physically challenged woman, must not have access to sexual and reproductive rights? So when such a thing happens, we suspect that if a person with disability, is confirmed positive, such person may equally be abused. Such person may equally be denied appropriate medical care, to survive. So we are saying that we need to know number of people that are positive to, to the virus. We are also calling on the Minister for Humanitarian Affairs, Disaster Management and Social Development to take appropriate measure to advise President Muhammad Buhari to establish the National Commission for Persons with Disabilities. Until this commission is established, all this gap will continue. What is the purpose of this commission? The purpose of this commission is to advise the government, is to set guidelines, is to support and advise people with disabilities on opportunities that are available for them. It's also to advise different sectors, be it economic, be it political, on their role and responsibilities in order to ensure that the Disability Act is properly implemented. If such is not available, we'll be struggling to know who to talk to, how to talk to, and when to talk to. Knowing fully well that in Nigeria, if you're not at the policy seat, you will not be included. It's about write my name. If your name is there, if your name is not there, you will not be factored in. These are the challenges we are having. And we are saying now that they are drawing the budget for 2021, that the budget should reflect, Section 2 of the Discrimination Against Persons with Disabilities Prohibition Act and Section 31, which, require the federal government of Nigeria to take measure to reduce the burden of living with disabilities in this country.
All right. Thank you very much. Great pleasure. How time flies when you're having a good conversation, especially with David Anyele, Executive Director, Center for Citizens Living with Disability. Always great to have you. And this conversation is a rolling one. We'll make sure as much as possible we touch bases with David Anyele to find out just how much people with disability have been taken into consideration. Next up is security in the northwestern part of the country, where protests have rocked several cities in the north. Let's find out what the discussions are around and what the implications are on News Hub. Please keep watching.
You say something, you say no.